I have a unique perspective to present here, which is very basic in nature. We have experts here who will be talking about robotics. We have experts here who will be talking about delivery systems, healthcare education. We also have our esteemed Dr. Bose from the armed forces, where he wishes to talk about patient-doctor relationship. Excellent topic. I was really very happy to hear this. I mean, among discussions on innovations and advancement of medical systems, we have somebody who wants to talk about the very core principle: patient-doctor communication, understanding, relationship, trust, etc. Superb. He actually inspired me to select my topic, and my topic is very basic. It is patient autonomy. I will explain this to you. First, let us start with the basic Hippocratic oath. Basic Hippocratic oath which we doctors take when we become registered. Primum non cere. First, do no harm. Whatever you may do, whatever you may not do, but do not do harm. That is the basic fundamental of medical practice. So, let us see what unfortunate things are happening in the medical world. We already know of great achievements and how advancement in the medical field and increase in life expectancy and better treatment modalities. But I wish to highlight what is happening, which is unfortunate. Let us begin with medical field. Since we have a short time, I will be just taking small random examples. Let's take the issue of antibiotics. Everyone is prescribed a single antibiotic. People who are admitted are prescribed an umbrella antibiotic. For one particular type of organism, gram-positive, one antibiotic, gram-negative organism, another antibiotic, anaerobic organism, another antibiotic, and one overall antibiotic. So each one who is prone to infection is subjected to umbrella antibiotics. Now the question is, do we really need to do this? Each antibiotic will have its effects on the liver, on the kidney, on bone marrow. One, let's take the other example. Cancer, dreaded disease. Sentence passed on the patient's life. बेचारे को कैंसर हो गया. Now there are different types of cancers. There are cancers which respond very well to treatment, to chemotherapy. And then there are cancers with very low life expectancy, where you see the patient, most of the patients are dead within 6 months. Cancer pancreas, a life sentence, a death sentence of 6 months. In cases like this, there are chemotherapeutic regimens which are offered, and the percentage of chance of survival is barely 10%. So if you take chemotherapy, you have just a 10% chance of survival. If you don't take it, then you're 100%. Now, in this instance, the chemotherapy can make life very difficult for the patient. He could have anemia and he could lose energy in even visiting the bathroom. He could have fall in his WBCs and subjected to recurrent infections. He could develop pneumonia, he could go on ventilator, he could develop septicemia and go to the ICU every now and then. If his platelet drops, he would bleed from his nose, he would have intra-abdominal clots. If he bleeds in his brain, he would get a stroke. So, here is primum non cere. Let us not do harm. The patient needs to make that choice, whether I will take that 10% chance or I would rather be left in my relatively better state of health. The patient needs to make that choice. And that's the reason my talk for today is patient autonomy. The right given to the patient to make a choice. Let's take the other one. I don't want to talk about COVID. The great drug, remdesivir, which saves a patient. I'll say only one line. If you visit Wikipedia and you check the side effect of remdesivir, 2 words, respiratory failure. It has now been withdrawn as the first drug which is given. Now, if you take surgery, every appendix is removed, whereas the text says after 48 hours, don't touch an appendix. A gallstone being passed, gallbladder is removed. Whether it is to be removed or not is a deliberate decision made after a lot of considerations by the doctors, by the patient. Every woman is subjected to cesareans. That great thing, बच्चे को बचाओ, माँ को बचाओ, which may not really be needed. Every old joint, replace. You can afford it. You got insurance. Replace. What if the lady doesn't want the replacement? She's okay, toddling, 75-year-old lady. Do you want to subject her to a choice which is not hers? We replace the joint, allow her 3 months to heal, 3 months of agony with the joint swollen. May not be her choice. So we come to a conclusion that we need medical ethics committee. Now what is medical ethics? Medical ethics based on 4 pillars. First pillar, beneficence, do good beneficence. Second, non-maleficence, don't do harm. Third, justice. If there is medical negligence, we'll give him justice. All 3 are well in order. The 4th one, autonomy. The patient should be given a choice to decide depending on what is sensible and what is not, and his point of view. Now, autonomy, which is part of medical ethics, no importance. आप ये क्यों कर रहे हो? डॉक्टर ने बोला और कोई चारा नहीं. So, we need to expand our medical ethics committee duty to provide autonomy. Information should be provided to the patient. Now you go to Google. You go to Google and ask Google, should I operate? Google will say yes. You ask Google, should I not operate? Google will say no. No. So whatever you want, Google will give you. You will always find a link which supports your point of view online in search engines. So, who is going to decide what is authentic, what is not authentic reference online? Somebody needs to do that. So we have information, but we have a lot of information and we do not know what is reliable, what is unreliable, what is quack and what is science. Therefore, I would like to end my talk with a simple suggestion that there should be an innovation which brings autonomy to the patient's hands. Maybe an ethics committee which is open to discussion to each and every patient. Whoever wants to seek a consultation, you want to seek a consultation orthopedic, yes, you get it. You want to seek a consultation surgical, you get it. If you want to seek a consultation from the medical ethics committee, should be available. This is just an idea. Ideas always seem random, they seem impossible, they seem crazy, but that's how it begins. Imagine in every healthcare setup, if there were a medical ethics, patient autonomy consult available, so many people would go there. So many people would go and say, tell me details. ये मैं प्रोसीजर करेगा तो क्या साइड इफेक्ट होगा, नहीं किया तो मर जाऊंगा क्या? Such important questions which in routine consultation the doctor doesn't have the time nor the inclination to answer. What about an app? An app where the patient can directly seek information on his predicament, on his illness. What about other delivery systems where, let's say, telemedicine just calls up and says, I wish to discuss this. Don't you think all of us would have great power of choice in our hands? And with that I conclude that patient autonomy made more available to the patients is the primary basis of my talk and of healthcare innovations. Thank you.